So if the flood was something that was never experienced before by myself or my community, and we could never have anticipated it before. In fact, it's been described in the news as a 100-year flood, where statistically there's only a 1% chance of it happening in any given year. So I felt a deep sense of guilt to the communities we served. For example, we had to see pregnant mothers for their antenatal checkups, and we had to do so in makeshift outdoor spaces where they were exposed. There was no proper infrastructure to redirect them to because neighboring clinics, some of them were also affected, and they were also dependent on the clinic services. So the only choice that they had was to alternatively they would pay out of pocket to access private care. And so some patients would come afterwards and they shared stories of losing their livelihoods and their loved ones from the flood. Some of them had sustained injuries. There was also an uptick of infectious diseases such as dengue, leptospirosis, and acute gastroenteritis following the floods. But as a healthcare provider, there was very little that we can do to help. And being in that position where the patients come to you wanting help, wanting assistance, wanting healthcare, but you not being able to do anything and not being able to guarantee that this wouldn't happen again in the future, it really brought on a lot of moral distress for us. I felt that in some tiny way, I had also contributed to climate change because my house and my workplace is quite far from each other, and there's quite a distance between it. And I took it upon myself to enroll in a sustainable healthcare course online. And from there, I learned that Scope 3 emissions from transport and travel of myself, but also of my patients, they were all part of the problem. And it felt like we were doing healthcare wrong. So I got in touch with some people up the chain in my organization, and I shared the struggles that we faced in the clinic with damaged equipment, with improper waste management. Also, I brought up the issues of the lack of clinics and infrastructure for patients to access in their neighborhoods and in their communities because of how far we had to travel just to access healthcare. And they were, in general, helpful and they gave support. There was also a provision of new assets, but my direct superior wasn't very happy that I went over her head. So she made life very difficult for me in the clinic because I think to some degree it does reflect on the shortcomings of clinic management. In the healthcare fraternity, there is an existing stigma related to mental health, in addition to the social stigma of mental health. So it's not very easy to share problems related to your mental health as part of the healthcare fraternity itself. And also, I think for the most part, healthcare professionals are quite high functioning individuals. So in terms of resilience, we're kind of used to just being able to adapt and face whatever situation that's being thrown at us. So for me personally, I became a little bit withdrawn and I became easily emotional as a result of my superior's clear and obvious dislike of me. She had actually written into our state health department that I had become too vocal for voicing out the issues in our clinic. And as a result, I lost weight. I had poor sleep. I would occasionally break down in tears in front of patients as well, all of which resulted in me being asked to attend counseling sessions, which were actually very helpful. So I took up a course in sustainable healthcare, and I also signed up for some micro credentials. I find that equipping yourself with knowledge helps you to understand the limits of what you actually can and cannot do, because sometimes it can feel very helpless. You are in a position where you want to help the patients and you want to help yourself, but you really can't do much in the end. It feels like that. So equipping myself with knowledge and using that knowledge, mobilizing myself into action is how I cope with the emotional distress. As doctors, as healthcare providers, it's ingrained in us to do no harm. And I think it's important that we take stock of what it is that we're actually doing, because inherently there is sometimes harm involved in the activities that we do as part of delivering healthcare. So talking to other people who understand this, for example, the nice folks at Healthcare Without Harm, they've been really helpful in trying to see what my role actually is. Being part of something bigger than myself, collaborating with others who are also on the same journey, and realizing that I'm not alone, that there is support, and that sometimes you have to reach out beyond your usual circles. But there is definitely support out there.